Everyone, we'll get started a little bit early. Any objections? All right. I always like to start early and finish early, right? That's a good rule of meetings. So we're so thankful that everyone made it tonight. Yay! We didn't have to slide in on the ice. Everybody was accommodating with changing the dates. And if you don't think changing an event one day prior to the next day is easy, it looks easy, right? It's super easy. But we are so glad that y'all came and made it tonight. We think that heart education is a very important topic, particularly for our community. We have a lot of opportunity, and we are very pleased to have Dr. Bellbell with us, Dr. Roger Bellbell. He's with Greenville Cardiovascular Associates. If you don't know, Dr. Bellbell and his associate are on call 24/7 at the hospital. So if you come into the emergency room and you have a heart event, you're probably going to visit with one of them. And we're very glad to have him in our community. He is a retired Army colonel and has 25 plus years. We call it 25 plus, right? 25 plus years with cardiovascular education and intervention and treatment of that. So we're super excited to have him tonight. We also have Mike Crump with us. He is the director of cardiopulmonary and the manager of our Cath Lab, our cardiac Cath Lab. So if you were to come in and have a procedure done, he would be the person that would supervise that, and he's going to tell us a lot more about what our Cath Lab does. And then we also have Desi Tapp with us tonight. She is the coordinator. We have some fans in the audience. They only see Mike when they're still asleep, right? So Desi Tapp is with, she is the coordinator for cardio and pulmonary rehabilitation. So if you do have a heart event or have some heart issues, you can visit with her, and she's going to tell us what she does. But I want to welcome right now Dr. Roger Bellbell.
I want to welcome everybody. You can all hear me.
You can take that off if you feel more comfortable.
Yeah, I can walk around. Okay. I don't know what's going on here. I left Massachusetts and it's following me here with this crazy weather. So I thought I was going to talk a little bit about men's health tonight, cardiovascular men's health. But since it's a mixed crowd, I'm just going to wing some of it. So we're going to go through the slides. Just to start off, I think the most important thing you all should know is the most lethal thing that kills Americans is still heart disease for men and women. And it came 50 years later, despite all our treatments, we still have that problem. So I think in the United States, it's still the most likely visit to a hospital is a heart or vascular related event that gets you in the emergency room. So a lot of reasons for that, obviously, but one of the most important things that I can tell you is surviving a heart attack is dramatically better now compared to 30 years ago. So that's important news to tell everyone. Your chance of surviving a heart attack is about 30-40% better than it was 30 years ago. So now we look up here and we see this is the pathology on your left, on my left, is a artery of a patient who died of a massive heart attack. And the inside of that artery is a bunch of clot and cholesterol debris. Everyone see that? So the question is, how do we avoid that scenario? Because that scenario is a pathology slide of someone who didn't make it, obviously. And you don't want to have that happen. So when we go look at the slide to my right, that's another artery where there's a buildup of cholesterol and debris in the artery, but it really hasn't closed the artery. The lumen of that artery is still open. So the question is, how do we avoid this left-sided scenario and get something done when you're in that scenario, which is the artery still open, but there's buildup starting. And that's the question that's afflicted the medical community for a long time. We haven't answered. So, as you can see, there's a buildup of debris, I would say around 11 o'clock on that slide. And that debris is, if it bursts open, if that lining around that little debris bursts open, it triggers a whole clotting cascade inside your body that causes a massive heart attack in minutes, okay? So some of you here know what that's like because you showed up in the middle of the night and had us work on you. So what happened is a tiny little blockage broke because of smoking or stress or high blood pressure or whatever, and that lining that protected that the inside of the artery from the outside gave way, and once that debris makes contact with your blood flow, immediately you clot off. So that's what causes a heart attack. Okay. Now this debris on the right will keep growing and growing and growing. As it grows, it'll cause chest pain because it's impeding the flow of the artery. Does that make sense, everybody? It's like the hose is getting squeezed and squeezed and squeezed. So that raises another issue, is how do we reverse that or make it go away? We don't want it to progress. So if you get lucky enough where you don't die because of the wall giving way right away, when there's a little bit of blockage, then as time progresses, you start having a bigger and bigger blockage that doesn't kill you right away, but causes you to be short of breath, have chest pain, back pain, winded, no energy. As that blood flow is limited to the heart, that's what's happening. So the left side was too late, the right side, we have time to fix it. Okay, next one. So how do we detect blockages? And that's something that, like I said, is really fascinating people and haunted doctors and scientists. So one way is what you see on the left is a stress test, a nuclear stress test. I'm sure some of you here have had a nuclear stress test where they either injected a chemical to speed up your heart or made you walk on the treadmill and then took the pictures before and after. And what they're looking at is to see if there's a, between when you're exercising and when you're in steady state, what is your blood flow doing? Is there a blockage there that's limiting you from getting good blood flow down there? And this test on the left, in most places, is about 70% accurate. It's available at Hunt Center. It's a good test. It's a great test. But it's really designed, and this is the important issue, to pick up late disease, not so much early disease. Okay, everyone hear that? So it's going to pick up the severe blockage or the moderately severe blockage, but we will not pick up the early blockage. And like I said, it's the early blockage that causes the heart attack. How do we know this? Well, this goes back to my Army days, actually. And so this is something that fascinated the military for a long time, because the military has autopsies going back from the Civil War on now, okay? And we did autopsies on people who were injured and were killed in the field, obviously, in combat. And even back in the Civil War, they were able to figure out that 18 and 20-year-old males had that early buildup of heart disease in the lining of the artery. Okay? And as that lining occurred in that artery, they got calcium, a ring of calcium, that protected that debris of cholesterol from getting inside the artery. So God in His wisdom provides this lining, but calcifies it. It lets you deposit calcium around it to seal it off so it doesn't penetrate to the blood flow. Okay? So we knew that going back to the Civil War. We knew that at 18, 20, 22, people were developing heart disease early on. As we get older, we started getting heart disease. Okay? Whether that's a genetic thing or our diet or life or God's little way to get rid of it, nobody knows. But it happens. So we were fascinated. How do we pick up that early disease and treat that early so we don't get to the disastrous shit, right? Because by the time you're doing a stress test, you probably got a lot of problems going on, okay? So there was a famous heart doctor, Walter Reed, who was also an engineer, And he was a heart doctor and an engineer, and he knew that CAT scans could pick up calcium buildup. And he was fascinated by the idea of finding a way to take pictures of the heart and see if he could pick up that calcium ring early. And why was he interested in doing that? Because every year in the military, and I'm sure there's plenty of people here that have served in the military and will know what I'm talking about. Every year in the military, we lose our top enlisted people and our top officers as they get into their mid-30s and early 30s and early 40s. We have people drop dead. Whether it's an F-16 pilot who crashes into a mountain, which happened in my sector as a cardiologist. We had 1 year 2 F-16 pilots crash into, and when they did their autopsy, they had severe blockages. And they had passed the stress test. Okay? So the military actually does stress tests. As you get to a certain age, you can't fly, you can't be a commander unless you pass a stress test. You can't be a sergeant major, as in the Army, unless you pass a stress test. But the stress test wasn't picking up everything. It was picking up severe disease, and we picked up a lot of severe disease, but we were not picking up early disease, because 30-year-old and 32-year-old pilots shouldn't have massive heart attacks and destroy a $50 million plane. So as you can imagine, we had some very upset admirals and generals and people going, what the hell did these cardiologists do? You know, it's ridiculous. So, so this guy knew, this doctor was also an engineer by training, knew about this, and he eventually was able to do what's called a calcium score on a CAT scan. And the calcium score, he developed it, it was his baby, and the first CAT scan took 4 pictures in 6 minutes. Now we have CAT scans that take pictures in 10 seconds, 30 seconds, and they take thousands of pictures and hundreds of pictures. That's how much the technology is advanced. I don't know if anyone here has had a calcium score. I know some people have a calcium score. But let's go back again. So as you can see on the right, I'm going to step up here so you can see it. This is the heart, and this is arteries of your heart coming off. And you can see this white debris lining. That is early calcium buildup on the outside and some on the inside of the artery that will not be picked up by this test, but is absolutely picked up by that test. Everybody see that? So he eventually was able to convince people to do this test. And the test, you can get this test in 2-3 minutes. I think it takes longer to sign up for the test than they actually have the test. It's a great test for people who want to get screened, okay, for heart disease. So, next slide. This is our old governor, but the point of this was that he had signed a bill authorizing private insurance and Medicare to pay for this test. And to this date, we have a new governor. It's still not approved, unfortunately, by insurance companies. But I think the hospitals have done a great job of making it very affordable out of pocket. And $75 here locally. And it's well worth the test. So, anyway, next slide. So here you see, this is actually a picture of a pilot who died and had at the autopsy. They took a calcium score, they took a calcium score of the heart before they did the autopsy on it. And this is what they saw. So they knew before they even opened up the artery that this is what they were going to find. So he had a severe obstruction of his widowmaker artery, as we call it, the main artery of his heart. This was a 32-year-old naval pilot who died near where I was working. So, next slide. So, the thing is, this is a glacier, and the point of this slide is to show you that what you see in that little buildup of calcium hides a lot of what's going on inside that artery. But it's a warning. Just like the glacier is a warning, some people ignore it. Don't ignore that glacier, because there's something going on, right? So I think the point of this is how important this test is and how affordable this test is. And it could save people's lives. Next slide, please. So the score was devised, and basically your goal is to get a 0 score, which means you got no blockages. And we see a lot of zeros, actually, amazing. And let's go back one more. Stay on this slide, please. So as you can see, it takes the calcium score and puts it into certain categories. Okay, I think the important thing to know is if your score is not 0 and you have something above 0, you probably should see a heart doctor. Okay, and immediately, probably if your calcium score is above 0, you should strongly consider taking a baby aspirin. Because by definition, if your calcium score is over 0, you have heart disease already. So if you get a score between 1 and less than 400, often we can reverse that. We can reverse that by changing your diet, giving you cholesterol medicines. That's the question we get all the time. Why are they putting me on a cholesterol medicine? My cholesterol is normal. Well, if you have this test, then that would be a real good reason to explain why you should take a cholesterol medicine, right? Because you for sure have heart disease. It's not a question, right? So if you end up with a score above 400, you're probably going to end up seeing Mike and myself at the facility, because that's considered a highly abnormal test, and you deserve at that point to get a heart cath to see if you have a blockage that's severe enough to need a stent. So a score of 400 above is considered by the American College of Cardiology and the American Heart Association to be a high-risk finding. Scores below that will depend on how high the score are, whether we look or whether we not look. Sometimes we'll see a low score, but it's in a dangerous artery that makes us nervous, and we may look even if your score is 50 or 100. So, next slide. I'll skip this slide. I think the important information I've given you. Are there any questions regarding this real quick? I know I gave you a lot of information. Pretty shocking, I would bet, right? How many people knew about this test? Not good, not good. I think you should educate your doctors and your providers so they know this. Because a lot of providers may not know this actually, that this exists. And how simple. I don't know how many thousands of calcium scores we do a year.
Over 6,000 have been done since we started doing it.
Okay, so we've done over 6,000 since we've been here, over 5 years. That's a lot. And it's available in every community.
So what does the calcium test consist of?
You come in, you sign a paper, they put you on the CAT scanner, the machine goes over you in about 30 seconds and you're done.
Yeah. No poking, no prying.
No needles, no
prep
nothing, you
work.
just have to hold your breath for 30 seconds, I think, or something. It's the quickest, easy, and the newer the machine, the less you have to hold your breath. Imagine in the old days, you had to hold your breath for almost 2 minutes for them to take 4 pictures. I think I'll stop now and let someone else talk. So if you get past us, you end up in his facility.
Thank you, Dr. Belleville. Good job. As you mentioned, my name is Michael Crump. I coordinate Cath Lab, cardiac pulmonary, that kind of thing at the hospital. So I look at things from more of a mechanical standpoint. I'm a mechanic. Back in the day, I was an aircraft mechanic. Then we got into X-ray, and then I became a nurse. So I've kind of got a varied background. Before that, oil field, so some serious plumbing back there. But, so we have 2 kinds of cardiologists. We got plumbers and electricians. These guys are plumbers. So they're looking at the blood flow that goes to the heart. And we've also got electrophysiologists that look at the electricity that goes through the heart. So it takes both of them to make the heart work correctly. The heart is a pump. So I kind of like to think of what we do as we're kind of pump maintenance. So we go in and we test the pump, look at how it's pumping, and then we fix it if we need to. So the heart is a positive displacement pump. So what it does is you've got, a void here that fills up with blood, and then it squeezes and pushes that blood out. And that's called positive displacement. So that's how the heart pumps. It pumps blood all over the body. So being a muscle, it needs oxygen. So the muscles require oxygen to work, and after they get done, then you've got to get rid of the carbon dioxide that it creates. So that's what your blood does. So your blood carries that oxygen to the muscle, and then carries the carbon dioxide waste away from it. Takes it to your lungs, where you breathe out the carbon dioxide, you breathe in oxygen, reload that blood, and it goes back again. So the heart's, obviously pumping that blood all around your body, all your muscles, all your organs, keeps everything oxygenated, working, that kind of thing. So when you have a blockage in your heart, that portion of your heart that is fed by that artery is not getting enough oxygen. So when you created the demand for oxygen by exercising, something like that, and the muscle can't get that oxygen, it doesn't like that. And so what it does is trigger pain mechanisms to tell your brain something's wrong here, and that's chest pain. Now, where you're from, they say angina or angina?
Angina.
Angina. So I grew up here, so there's angina here, but where he's from, it's angina. Either way, it's chest pain that's your heart. So that's usually people's first sign, is that, they're getting pain. So, you can have pain while you're exercising, and it stops when you rest, and stable angina, or it can just come on when it shouldn't. We call it unstable angina. That's a very ominous sign. If people don't pay attention to that, they wait until they have a heart attack, which means that your options are very limited. When that vessel, and he showed you in the slides how they get worse and worse, and that narrowing gets narrower and narrower and narrower, and if you don't pay attention to it, eventually it shuts down. That's when you have that heart attack. When it shuts down, you're not getting any oxygen to that portion of the heart that vessel feeds. So once that happens, that muscle starts to die. And when it does die, the body will actually rebuild it, but it doesn't squeeze right there anymore. So that's not the same kind of muscle as it was before. So then you have permanent damage. So then your heart can't squeeze like it did before ever again. So what we try to do in the Cath Lab is catch that as quickly as possible. So if you're having that heart attack, we have a goal of under 60 minutes from the time that you hit the door of the hospital until we get that vessel open. What really can shorten that time and increase your chances of having a positive outcome are to call 911, because they can actually start treatment when they get to your house or wherever you are, and start treating you on the way to the hospital. They can actually get us on the way to coming in, and everybody can meet at the hospital, and it decreases that time that it takes, for you to get treatment. When you do get there, what we do is we take a long, skinny tube, and we go in either through your wrist. Now, if it's an elective procedure, so if you haven't waited until you've had the heart attack, and you've had one of these tests that he described, and it indicated that you had some disease, well, all of those tests that he talked about, they have false positives, false negatives. They're good, but they're not the definitive test. The cardiac cath, it is definitive. Once you have that cath, we know if you have coronary artery disease or not. If we get in there and we see you have disease, there's a couple of options. Depending on the severity and how many you have, we can fix you right then, put a stent in, send you on your way. Or if it's something beyond the scope of what we can do through that little tube, we'll send you for a surgery consult where they open you up and do bypass surgery. But the way we accomplish that, so like I say, if it's elective, if you don't wait till you have the heart attack, we go through your wrist, long skinny tube, we run it through the arteries, and we engage the coronary arteries in your heart with this little tube. When we do it so often that we kind of take it for granted, but when I talk about it, I realize how difficult that actually sounds for us to be able to do that. But these guys are amazing. Their dexterity and, looking at an image and being able to manipulate that catheter to get it into that artery, just looking at a two-dimensional picture. It's incredible. Like I say, we take it for granted because we do it all the time, but it's amazing. So once we get that tube in there, we need to look at those arteries, and we look at it with X-ray. The problem with that is that all the tissue is kind of the same atomic number. That's just a fancy way to say that X-rays pass through it about the same, so the artery is going to look just like the rest of the tissue around it. So what we do is we inject some high atomic number liquid, which is an iodine-based contrast media. We have it in a syringe, and we inject it into that artery. Well, then that makes that artery show up under X-ray. So we can kind of temporarily replace the blood with this contrast media and look at it with a live X-ray, and we can look and see where the narrowing is in that artery, if there is any. So we can pinpoint it and know exactly where it is. We can also see how big around it is, how long it is, that kind of thing. So then we can size balloons that we need to open it up and stents that need to go in there to hold it open. So we go in with a really soft wire into that vessel as a placeholder. So we have this tube in there, we run the wire inside the tube, the wire goes inside the artery, and then we run balloons and stents over that wire. So the wire stays there just as a placeholder so we can get back to the same spot every time. And then we go in there with a balloon, open it up, push that crap back, to kind of get that thing open. And then once we come out with that, and then we go in with a stent, which is like a little metal cage. You remember those little Chinese handcuff things that you put your finger, okay, well that weave looking at, that's kind of what a stent looks like. And it's crimped down on a balloon so we can get it in there. Once we get it in there, we inflate that balloon, and that metal thing, comes off the balloon. You deflate the balloon, pull the balloon out, and that thing stays in there. And what that does, that holds that vessel open. So that we reestablish that flow, and therefore that oxygen to your heart. The thing is that, to be able to get you there early and do this before you have that heart attack, that's the key. And that's what all this is about. It's about early detection, knowing that you have a problem before you wait to that heart attack. Because we know a lot about heart attacks, and we know they're bad, and you don't want one. I mean, trust me, there's a lot of times people don't survive those. The longer you wait, the less option we have. So, like I say, the testing, we're doing calcium scoring for
$75.
$75. That's money well spent. You go in there, you spend a few minutes, you get the scanner, they scan you, $75. If you don't have any problem, you got peace of mind. If you do have a problem, we can start the treatment process. You get with one of these guys, and medication, that kind of thing, so you don't get bad enough where you got to come see me. We have, stress testing. We have a lot of non-invasive testing to do before you actually have to come to the Cath Lab. But you have to start that process, and you have to listen to your physician. So if they do tell you to do something, I know everybody in here is super compliant. You eat right, you take your meds, you go to the doctor. I'm talking about all the people out there. So it's not you guys. That wouldn't be you guys. So anyway, I could talk about this for 2 hours, but I'm not going to sit here and bore you with all this stuff. But I'm very passionate about what we do. We have a great crew. We have a great facility, great administration. One of the former administrators here, Rich Carter, is a former CEO. Had a very long tenure. He's been replaced by Lee Bowles, who was the chief financial officer under Rich, and he's taken us, continuing in a good direction for the hospital. Hospital's expanding, the area is expanding, but like I say, it's a really good facility. We have really good outcomes. Our outcomes in the cardiology department compare with any other facility that is around in the nation. We report data to a database, and we compare ourselves to the rest of the nation, and we rank in the 90th percentile in just about everything that we do. So these guys are to be commended. They're doing great work, and our staff are doing great work as well as everybody else in the hospital. So, does anybody have any questions? Okay, let's start with you.
How do we go about if we want to have these tests? Where do we go?
Just call.
I'll step in here. Inside your envelope or your folder, there is a flyer on the cardiac CT score, calcium score. It's, as they said, it's a simple procedure. The most time it's going to take you is to call the 903-408-5010 and make an appointment. You'll make that appointment, you'll come to the medical center, you'll go to registration, you'll sign 3 forms, and then they'll take you back. You don't even have to get undressed. It is that quick, simple, and then you'll get, if you have the portal, usually the next day, that $75 includes the radiologist read. So if someone says, oh, your insurance might cover this, we have found that offering it at the $75 is really the best price because it includes the radiologist read. If you do it with your insurance, you may not have met a deductible, etc. So it really is easier to do it with the $75 pricing. Any other questions on that?
Thank you.
So,
Oh.
insider knowledge.
Oh, sorry.
If you're a woman and you're going in for this calcium score, don't wear a bra that has metal in it.
Take off the wire.
You have to have a doctor's order?
No doctor's order required. Dr. Bell has signed an overarching order to be able to do that. And I see a lot of hands up. I want to also brag on Mike real quick. He mentioned that 60 minutes is the goal to blood flow from the time you come in the door. That's 30 minutes approximately faster than the national average. So.
Yes, sir.
Were you in the Cath Lab August of 2018?
I think it
Yes.
was.
Yes.
Thank you.
My pleasure. My pleasure. You're obviously a customer. Well, good. Looks like you're doing great. I'm glad we could
Done
help
right,
you.
thanks to him and her and you.
Absolutely. That's a success story. That's why we do what we do. That's exactly why. Yes, sir.
I had a test 2 years ago. How often should you do it?
Every 2 years. The reason for that is there's radiation involved.
Absolutely.
So you don't want to get too much radiation all the time.
So, and that's we try to balance risk versus reward.
Brian, will you answer that into the microphone?
I'm trying.
The answer to 2
Oh.
years?
2 years. Did everybody hear that? Sorry. It's risk versus reward. So there is no such thing as an X-ray that doesn't do any damage. It's very minimal, but the potential is there because when we shoot X-rays through you, if it catches a cell while it's dividing or something like that, it can make little point mutations in the DNA, that kind of thing. It's exceedingly rare, but there is the potential. So we try to minimize, the amount of radiation you get. You get radiation every day. You get it from the sun, you get it from radon, you get it from, everything. But, we try to limit what we give you, in the medical. But like I say, that balance, now the coronary artery disease is much more dangerous to you than the radiation. So obviously, we want to balance that so that the 2 years, I think that, if that's what he recommends, that's what you ought to do. Mr. Carter.
Do you have to go through MD Save to get that price, or is this a direct thing?
Most people wouldn't notice, but it is through MD Save, yes. At the registration, they'll get you taken care of.
Okay. You want to explain that, because I think that's worth knowing.
Sure.
Absolutely.
So MD Save is something that we have at Hunt Regional that you can actually go to mdsave.com/Hunt Regional. And you can see what any test cost you if you were to pay cash pricing. So the cardiac CT score is $75. If you wanted to have a colonoscopy done, you could see how much that cost as well. But it is the upfront cash price that will save you having any additional bills in the future. So it's a one-time charge, but you can have it for blood work. If you are uninsured or underinsured, you can decide that I want to have my A1C done or my lipids, or you can pick and choose, but you can pay a cash price if you choose not to use insurance or if you don't have insurance. Thank you for that, Mr. Carter.
And it's cheap. That website again?
It's mdsave.com/Hunt Regional.
Francis, what was that number you gave out?
903-408-5010.
Thank
That is to schedule most procedures, unless you're coming in through the emergency room. Or
If you come in through the emergency room, you don't need an appointment. But we want to wait till that point. We want you to take care of this stuff before you have to come in. Anybody else? No? Yes, sir.
Do you do ablations here now?
I'm sorry?
Ablations. Do you perform ablations in Greenville now?
No, ma'am. We do not do electrophysiology. That's not part of our capability, but we partner with several electrophysiologists that if we identify that you need that through an EKG or some other means, then we absolutely can refer you to somebody that can take care of that. Yes, sir.
How soon does a patient get the results from the cardiac scoring test?
A day? Yeah, a day.
If you have a
Maybe that
patient
same
portal,
day, depending on, you know.
if you have a patient portal, you can usually log in within 24 hours and see the results.
Yeah.
If
Yeah.
you're waiting on it to go to your physician and then come to you, it may be a little longer.
We have the results almost immediately, but it has to be interpreted by a physician before we release that. And typically, they're really quick at getting that, so, you know, a day. So, anybody else? All right, thank you so much. I appreciate the time. My name is Desi Tapp. She's the director of cardiac rehab at the hospital, and she's going to tell you about what happens after you do the testing, after you come to us, and then your rehabilitation after that in cardiac rehab.
Thank you. Hi, so yes, we're a little bit more fun than that portion. Cardiac rehab, we're a program that's designed to improve your cardiac strength and your heart health after you've been through the ER, you've been through the cardiac cath process, and we want to build from there. Cardiac rehab is typically 3 phases. Phase 1 is going to be the in-hospital phase, okay? That's where one of the cardiac rehab staff members are going to come in to your hospital room. We'll see you while you're in the hospital and kind of go over what cardiac rehab is and get you signed up for what we call phase 2. Phase 2 is the exercise portion and the education portion that you would typically expect from cardiac rehab. Phase 3 is what we call our maintenance program. Okay, maintenance program is once you've completed the regular cardiac rehab and you've decided to continue your fitness with us, and it's more like a gym membership. Okay, so there's 3 phases of rehab. The optimal cardiac rehab program is going to be 36 visits, okay, or 36 sessions long. That lasts about 12 weeks. Okay. Every program is a little bit different, but the typical program should have supervised exercise training, an education portion, skill development, health training, so learning to read food labels and learning how to pick good quality foods and things like that, and counseling on stress, depression, and developing those coping skills and mechanisms. Our team at the cardiac rehab consists of several different types of team members. One's going to be your nurses. We will be working with the patients one-on-one with the medical records and assessments and things like that. We've got exercise physiologists that will be the ones that specialize in exercise and ensure that the patient uses correct form, technique with their exercise training. Respiratory therapists, those are going to be in charge of all the oxygen that the patient would use if they needed it, or if they were COPD, asthma, that type of thing. And then we also have a medical director that oversees the program and any daily activities, or if there were an emergency in the department. The strong evidence shows that any patient that's had a heart attack, angina, bypass surgery, congestive heart failure, any stent or valve repair or replacement can benefit from cardiac rehab. Okay, it significantly decreases mortality rates, depression levels, and increases overall physical abilities after your program. Many insurances do cover cardiac rehab. Your basic Medicare, all private insurances for the most part do. We have several programs available for patients that are underinsured. So please, if you do want to attend and you're underinsured, just contact one of the staff members and we will be able to work something out. So we ask that you touch base with us if that's the situation. We're easily located. We're on the 2nd floor, Suite 211. It's kind of known that if you can't find us, just listen for the music. Okay, we're a little loud.
Not a little, they're
Okay,
they're rocking and they're having.
we're
it's
very
like a
loud. We're
party.
probably the only department in the hospital that gets away with being that loud. But we do like to have fun. We're very upbeat. So we're a little bit different than some of the other departments that, you know, have to go through some of the more unfun things. But we do like to have fun. So typically, to be admitted into the program, we would need an order from your physician. Once we receive that order, what we'll do is get you signed up for orientation. That's usually on a Tuesday. The orientation's simple. It goes over your medical records, and then we'll talk about what you can expect from cardiac rehab, what we'll be doing in the sessions on a day-to-day basis. And you'll start that next Monday. And so it's pretty straightforward, pretty simple. The biggest thing is us getting that order from your physician as soon as possible after you've had your procedure with the Cath Lab. Do you have any questions?
I'm a new Medicare patient, so how long does Medicare let me go through cardiac rehab?
36 weeks, 36 sessions, 12 weeks.
12 weeks?
I have one other question for Dr. Bellbell. With those in attendance today who may or may not have had a CT score, what are some indications that they might need to consult a cardiologist or?
I think anyone who thinks they have some symptoms that are concerning should have a calcium score. The age to get a calcium score has been brought down. It's now 30 years, becoming a fatter society, unfortunately. So the age for males is 35, and for females 40, to start thinking about a calcium score. Yeah, you know, if you have a family history that scares you, if you have any symptoms that are concerning, you're not sure if it's your heart, your doctor's not sure if it's your heart, then you should for sure get this simple test. It's a life-saving test. And if symptoms that would be concerning to me is, you know, I could do a lot a month ago, now I can't do anything. Something's changed. You know, your doctor thinks it's asthma. You'd be amazed how many patients we see who thought they had asthma and it's their heart. Or their back and it's their heart. Or their shoulder and it's their heart. Sometimes it is the shoulder, so.
I thought I had a sinus infection.
Yeah, so. If something doesn't make sense, then you know, you can walk in and get the test yourself. Hopefully that answers it.
I had a chest CT just a few days ago, but I assume that they did that test.
No, they don't. So unless the doctor specifies that they should do the calcium score at the same time, they will not.
So she had a CT?
So she had a CAT scan for something else, looking at the lungs or the breast. Okay.
I don't know.
Sometimes they do. Look for calcifications in the breast with a CAT scan if your mammogram's abnormal. So it could be for that. But if you get a CAT scan, for whatever reason, of your chest, your doctor wants to get a CAT scan, and you remember this, I would tell them, can you add the calcium score to be done at the same time? It adds no more time, and it's the same amount of radiation. Otherwise, you're going to come back and get more radiation if they don't do it. So that is a pet peeve of mine. They do a lot of CAT scans in the emergency room, and I know they're busy and this and that, and they scan everybody and they forget to do that. So, but if you remember and you're about to have a CAT scan, sometimes even if they do the belly, they can catch the bottom of the heart. So that's something to know.
Any other questions? Ma'am, we're quiet during dinner, we're quiet during questions. Yes, ma'am.
I don't have a question, but I have another plug for the hospital.
Okay.
And that is the behavioral unit. That didn't get introduced to us until a year after the event, and it's made a huge difference, and it doesn't, I don't think that people readily know about it.
It's one of our best kept secrets. I'm assuming that you mean the outpatient behavioral health and commerce? Did you go to commerce?
No, the one on the second floor.
Okay.
Across from,
So we have a couple of options for behavioral health.
What's the question?
She was just commenting on behavioral health being beneficial to the recovery process. So we have a couple of options, and if you have questions on that, please let me know. We have an outpatient behavioral health and commerce that is an intense program, and it helps with those people who are suffering depression or a loss or something like that, and it's an intense program, so it's a long program. But we also have another outpatient kind of a clinic. And so if you have questions on that, anything related to behavioral health, please let me know.
I think one of the things they're trying to get at is, it's very important, which is about 60% of patients who have a heart attack or heart disease develop depression and anxiety at the same time. And it becomes a very serious issue for them. They're worried, this is a big change in their life. And your ability to cope with all that becomes very hard. And people don't realize, as they lose their ability to cope, they become very anxious, more anxious, and then it leads into depression. Two separate things, but they go together. So it is a very important thing. For example, you just had a massive heart attack, you just had stents. Are you going to be able to go back to work? How's your life going to change? All these things really go through the patient and the spouse's wife, the spouse at the same time, or the significant other, like what's going to happen? Are we going to be able to drive? Are we going to be able to do this? Are we going to be able to do that? What happens? So with that unknown, it is very common that happens, depression and anxiety. And depression and anxiety, even without a heart attack, can lead to a heart attack. We're seeing that dramatically increase. As you get more anxious, as you get more depressed, you start damaging your heart. And because when you get anxious and depressed, your adrenal gland, because it makes adrenaline, speed, starts damaging your heart if you're constantly under stress. That adrenaline is just pumping and pumping. Your heart races, your brain's racing, your heart's getting damaged. Which is, so I urge anyone who has mental health problems, get help for that, because it can lead to a massive heart attack.
So do we still have a behavioral health clinic at the hospital?
There are two options, and I don't want to speak to them because I'm not as clear on that, but yes, there are two options for behavioral health. So I can get with you offline. But if you have questions, please let me know, because we certainly want to make that available to patients who need it for sure. Any other questions? Okay, now for the fun part. Open up your folder. If you didn't open it before, now you know the CT calcium score is right there in front of you, first of all, and the number 903-408-5010 is at the bottom. But I want you to look for my business card. Most of you, I think, have a heart punched in it, or maybe nothing. But somebody has a purple smiley face on my business card. Does any of you have oh, that too? A purple smiley face? Yeah. Oh, you have a heart. You have a heart. So there's a purple smiley face. I was like, uh-oh, I punched too. So the winner is receiving a complimentary CT calcium score. If you choose not to use it, give it to somebody, because we want... So I want to thank you all again for attending tonight. We hope that this has been beneficial and educational. If you have questions, please let us know. We're here to help. We'd also, again, please leave your release to use your beautiful photos so that we can post those on social media. And I'm sure our guests will be up front for a couple of questions if they're... So thank you again for coming. We appreciate it. And if you have questions, let us know.